More than a year and a half after the pandemic began, Los Angeles County once again teetered precariously close to 1,000 coronavirus-related hospitalizations on Thursday, July 29, showing just how far the region remains from a full-fledged recovery. The county also reported its highest number of daily new COVID-19 cases since February, posting 248 new cases and 17 new deaths. All told, the virus has claimed 675 lives and infected 137 people. Even with troubling tolls of late, officials on Thursday pointed to early signs that an updated mask mandate and a major vaccination effort might be showing some hopeful signs of turning the tide of a troubling, weeks-long spike. The risk of increased spread within our county remains high, said LA County Public Health Director Barbara Ferrer, pointing to data that shows 15.7 new cases per 100,000 in the county, an increase from 12.9 new cases per 100,000 last week. Those are numbers, along with a 5.17% positivity rate, that put the county right smack into high transmission threshold, using the state's ranking criteria. However, last week's case volume was an 80% increase over the prior week. But this week's volume was only a 17% increase over last week. And while it was still too early to tell if the restarted indoor mask mandated kicked into gear nearly 2 weeks was having an effect, Ferrer was hopeful it could be signs the stats leveling out. This suggests to us that perhaps the rate of increase may be stabilizing, Ferrer said. Still, Ferrer pointed to concerning signs that an increase in deaths among black people amid the virus's recent spikes were beginning to show up in the data, though it was still too early for a full picture. On July 19, the death rate among black residents was 0.7 per 100,000. It rose to 1.2 per 100,000 by July 17. Other racial groups' death rates did not increase by July 17. But all experienced rises in case and hospitalization rates, with black resident and white residents seeing among the largest increases in hospitalizations. It's those hospitalizations, a lagging indicator that in past surges really begin to multiply in proportion to cases 2 weeks after case spikes, which officials are watching closely. So far, in the latest spike, that pattern has not fully developed, a good thing, officials said. We're not currently seeing that pattern replicate itself during our current surge of cases, Ferrer said. Although cases have increased by 740% over the last month, hospitaliations have increased by 180%. Fewer of our cases are becoming severely ill. Ferrer noted that 0.21% of positive cases are hospitalized, a far cry from the nearly 6% of positive cases that were ultimately hospitalized during the mammoth winter surge. Ferrer also noted this week that some patients hospitalized with COVID-19 initially came to the hospital for an ailment unrelated to COVID.